I spent 6 months working with members of the public and with non-academic experts who work on the front line in public health and emergency response to make new research tools. So I made a survey called the Measurable Hazards Preparedness, and I designed interviews, both of which asked people, would you describe yourself as vulnerable? And basically the data that I collected from that found that people that we might assume would describe themselves as vulnerable, or who we would be expecting to encounter health inequalities because of their circumstances, weren't actually identifying with that term. I basically started sharing my work as quickly as possible by emailing out preprints of my work, and I sent that to a team called the Government Office for Science, who said, well, this is really interesting, we're going to share this on with the Cabinet Office. The preprint that I'd shared just kept on being shared more and more widely, and I just kept saying, you know, thank you so much for sharing this. If you'd like me to come and give a presentation to your team, I'd be more than happy to. And people would say, well, that would be great. And I was just basically taking opportunities wherever possible. I applied to present a poster about my work at the UK Health Security Agency annual conference. I was very pleased that it got selected to be part of a showcase about health equity. So I presented at this breakfast panel about my work. So following the conference, I was contacted by UKHSA and I was invited to provide them with more information about my research. And I now know that that was taken forward to help them in some work that they have been thinking about doing already, but it really helped provide some impetus and a little bit more guidance for them on a terminology guide they were developing for staff, basically helping them ensure that public health messaging is clear and inclusive and evidence-based.